being a 33-year-old male and being healthy, energetic, and full of life just a matter of months ago to being told of my diagnosis of stage 3 testicular cancer. It's been, of course, a big wake-up call. So finding out where I could find the resources, what next steps, and my main concerns, of course, was what will entail for the next few months, next few years, or even the rest of my life in terms of what I'm about to go through.
For over 130 years, the Cecilia Fund has been helping individuals in our community with medical and dental expenses. What resonated with me in the Cecilia Fund is that they are the only organizations that step in with a medical or health crisis, again, to pay providers directly for expenses that wouldn't otherwise be covered.
At the Santa Barbara Neighborhood Clinics, we focus on folks who are underserved, low income, and the most vulnerable in our community. Oh my gosh, what an amazing organization.
The importance of dental care is multifactorial. For sure, it has a lot to do with your overall health. The most devastating situation, dentally speaking, for a person that has no means to pay for it is for sure a catastrophic event, such as, for example, you're diagnosed with a disease like cancer. And you have no choice, but you have to go and get all your dental needs taken care of before you would start, for example, systemic cancer therapy or radiation therapy. That's a really good example that makes it clear why we need the Cecilia Fund. For example, is you are a family with no money and you have a young child that has maybe 20 cavities at age 6. And there's no way you can afford a specialist to take care of a child's need like that. So these are the hardest cases. I have this young mother. She is 25, single mom, has a cute little girl, and has a almost complete set of teeth. But through an accident, she lost one tooth. Medicaid won't pay to replace that tooth. They may pay for a partial denture. Now, we don't want to do a partial denture for a single missing tooth. That's just something that doesn't make any sense. So the best option for a case like that, for a situation like that, is to place a single dental implant and replace that missing tooth. Because if you leave spaces, the neighboring teeth shift, and then you get more tooth loss. And it's really the right treatment. And so we reach out to the Cecilia Fund.
It really is this fund of last resort, stepping in when, again, an individual or a family is overwhelmed by a life-altering medical diagnosis. This can happen to anyone.
When patients come and they're facing a financial hardship, we try to exhaust all of their resources. And so when patients, if they don't have any insurance or lack medical coverage, and so that's when we'll come to Cecilia Fund.
Things when it comes to finances, although I do have a great job and I do have a stable foundation, things get rocked when you go through something as big as cancer treatment and having to get on hold, get on disability. Things, of course, need to be addressed, and thankfully Amy and those here, the social workers, have helped get me in touch with folks like the Cecilia Fund.
The Cecilia Fund has managed to be a lean, all-volunteer organization that commits almost every cent that they receive to those who need this critical care.
That was one of the first names to come up that she indicated and educated me on that she would be applying on my behalf. For me, going through this, I thought, okay, let's just get through it. I'm getting through it myself. I'm pretty independent. But of course, I have my family here that came from Northern California, spent weeks with me and still here with me today. It's been this drove of emotional of grace that I've seen. And then ultimately that translates to those that have donated or been part of these foundations that have the Cecilia Fund that I've been grateful to be awarded to help with the financial needs.
The Cecilia Fund has had to transform the way that they offer support and help to individuals over the last 130 years. It really is critical for us to be able to evolve with the systems of care, to be able to understand the coverage that's being provided or not being provided by health insurance companies, and to find those individuals that absolutely need our support to be able to access the care and course of treatment that they need.
It's a social problem, it becomes an economic problem. It it's something that's not just for the patient, but for their loved ones, for their family. We've always taken a holistic approach to care of our patients, so we're concerned not only with what it takes to medically help them be healthier, but what it takes to help them keep their lives secure and safe. You know, there's been a lot of attention in the country to the stress created by healthcare expenses and the extent to which so much is beyond the ability of many of our patients to afford. And you know, there's been a lot of attention appropriately to pharmacy and other costs. And this is particularly important in the new and emerging science of oncology, where so much of the new medical therapy that's being developed is therapy that comes from the outpatient pharmacy. So we've now had to confront financial barriers to care that we didn't see as often in the past.
The major obstacle is actually the fear of not having the finances. It's such a relief to them when they know a medical bill is going to be paid. It seems kind of disproportionate to what should really matter, but it actually makes such a difference when somebody has that financial relief. It's just, people are so appreciative, and it's always been that way.
The Women's Funds investing in us during this critical time of the COVID-19 pandemic has been instrumental in our ability to be able to serve more people. We know individuals have delayed ongoing care, preventative care, so we have a lot of families who are struggling in our community, and we know that we would not be able to address the overwhelming need that we're going to continue to see without contributions like the Women's Fund.